Hi there YouTube, Dr. Fakih here. This is the first of a series of videos that I would be posting on the labs that your doctor should order, but possibly or likely they're not ordering. And in this case, we're specifically going to talk about diabetes mellitus, specifically type 2 diabetes. So when we mention the term diabetes throughout the discussion, we're talking about type 2 diabetes. As a lot of you may know, type 2 diabetes is a rampant chronic condition in the United States, but also spreading globally, and is the cause of a lot of morbidity and mortality in the patient population as a whole. In fact, 1 in 10 individuals in the United States are type 2 diabetic, and 1 in 3 are pre-diabetic. So the goal here is to, while a lot of doctors may just focus on checking to see if you're one of those 1 in 10 individuals, we really should be focusing on, identifying those 1 in 3 individuals and actually identifying the people who are at risk of becoming one of those 1 in 3 individuals. So that's the purpose of this discussion, so that we can get the proper labs checked and hopefully prevent you and those around you and those you care about from developing type 2 diabetes. So let's go ahead and start out with the first one, which is insulin. Okay, a fasting insulin level is very important to check. I check it on all my patients, and in order to understand why it's important to check this, we probably should talk a little bit about the biology of insulin and type 2 diabetes. So in type 2 diabetes, it tends to be defined as a high blood sugar, okay? And that's kind of what most doctors check to see if a patient is diabetic. They'll check a fasting blood sugar, which if it's elevated, they'll determine that the patient's likely diabetic, or they'll check something called the hemoglobin A1C, which is basically the evaluation of the red blood cell and is the percentage of that cell that's damaged from the high blood sugar. So anything above 6.5%, meaning 6.5% of that cell is damaged by high blood sugar, then you're considered diabetic. But the way insulin and blood sugar works in the body is insulin helps lower blood sugar, okay? So when you have a patient who becomes diabetic, the reason their blood sugar is high is because they become insulin resistant, okay? And this is probably the most important factor in type 2 diabetes. Okay, and the way to think about insulin resistance is probably the same way you can think about somebody who's losing their hearing. So normally insulin tells the cells in the body, in general, at least in the setting of diabetes, to increase the uptake of blood sugar from the bloodstream and into the cell. Insulin resistance means that cell is becoming deaf or losing its hearing to the insulin or the response to insulin. So what the pancreas does is basically what a normal person does whenever they're talking to somebody who's losing their hearing. They shout. So the pancreas is essentially shouting to all the other cells by pushing out more insulin so that the cell will respond and take up the blood sugar so that it's not getting elevated in the bloodstream and causing damage. So in somebody who has insulin resistance, you're going to see very high insulin, and particularly anything above 5 is suboptimal, okay? Anytime they've done studies on centenarians, which means the people who tend to live into their hundreds, or they've studied people who have low cardiovascular disease in their older age, or they've studied populations of hunter-gatherers that have low incidence of cardiovascular disease, they all have a low fasting insulin less than 5, okay? So that really is the ideal. But to define a disease state or an abnormal elevated or fasting insulin level, it's greater than 20. So if it's greater than 20, absolutely you have insulin resistance and probably type 2 diabetes. Anything between 5 and 20, I would consider to be suboptimal and something that needs to be worked on, okay? Next thing we're gonna talk about is triglycerides. Now, triglycerides is part of your normal lipid panel or your cholesterol panel that most doctors do order. But the reason I bring this up is because one, it's not really looked at as a marker of diabetes or insulin resistance for most doctors. And two, even in the setting of trying to measure cardiovascular disease risk, a lot of doctors ignore it. They're basically just getting your cholesterol panel to look at the LDL cholesterol, which is the bad cholesterol, the total cholesterol, or your good cholesterol. Most doctors tend to ignore this number. But the reason it's important is because we know that anything greater than 100, and this is fasting, of course, when you've gone 8 or 9 hours without eating, is a sign of insulin resistance. And the reason this happens is because the fat cell, which usually maintains the triglycerides, have become sick and don't respond well to insulin. Okay, insulin usually tells the fat cell to hold on to the fats and triglycerides, but because they don't respond to the insulin, then basically you have leakage of the triglycerides from the fat cells, even in a state where there's not a reason to have elevated triglycerides. And so this is why you see high triglycerides in somebody who's become insulin resistant. The next one is uric acid. Okay, now most doctors only check uric acid in a patient who either has gout or has kidney stones. And usually they think, a patient who has a uric acid of greater than 8 or around 9, 10, then that will explain their gout and that will explain their kidney stones, and that's really the only time they're concerned about it. But anytime you have a uric acid greater than 7, okay, it also is associated with high levels of insulin and insulin resistance. And the reason this happens is actually quite interesting. So uric acid is a molecule that our body tries to keep stable, and one of the ways it does so is by pulling out uric acid that we're going to excrete in the urine, or that we're going to pee out. The kidneys have a transporter, or basically a little doorway, that opens up to pull uric acid out of the urine and back into the blood to maintain levels. And one of the hormones or molecules that opens that door and causes more uric acid to be pulled from the urine into the blood is insulin. So if you have high levels of insulin, you're telling that door in the kidney to stay open and pull up more uric acid, so you get higher uric acid. Now, and the way this happens is because that cell has not become insulin resistant yet, or just because certain cells are insulin resistant, and meaning they don't respond well to the insulin being high, not all the cells in the body do that. In fact, the cells that respond to it normally, that aren't deaf, are basically kind of overdoing their activity that the pancreas is telling them to do more. And so that's why you get uric acid elevation here. So again, another sign of high insulin resistance. Next we have Plasminogen Activator inhibitor. Specifically Plasminogen Activator inhibitor 1, because there's actually 2 of them. Now, basically this molecule is one of the molecules that helps break down clots. We have a subset of molecules in the body that help us make clots and a subset of molecules in the body that help us break down clots. And in a healthy person, you basically have this balance of both of these sets of molecules working together to kind of, make a clot when we need to have a clot and then break it down when we don't need it anymore. So the plasminogen activator inhibitor 1, basically, if this is too high, it increases your chances of making a clot when you're not supposed to. And this is very high in patients who have insulin resistance. And usually anything greater than greater than 30, I would say is concerning, okay? And is a sign of insulin resistance. It's also commonly elevated in obese patients. Interesting note is that for those of you who are have seen the news about COVID-19 and how one of the causes of death that's commonly seen are these development of clots, and they're finding that, or they're thinking that one of the mechanisms behind this is that people have this to be elevated, and so it increases their propensity to clots. And the other thing that we're seeing is people who have insulin resistance and who are obese have a higher incidence of complications with COVID-19, and so possibly a higher incidence of clot formation. The next thing is not a lab value, but it's actually a clinical observation that most doctors do not do, which is waist circumference. Most doctors focus on BMI, which is the body mass index. Any BMI above 25, you're considered overweight. Any BMI greater than 30, you're considered obese. And they really don't do waist circumference. And the reason this is important is because we know that even in the setting of a normal BMI, patients who tend to carry most of their fat or their weight around their abdomen have a significantly higher risk of type 2 diabetes and insulin resistance. So any waist circumference greater than 35 inches in women or greater than 40 inches in men is associated with insulin resistance and thus type 2 diabetes. So this is something you can check at home. This is a great way to kind of set a goal for yourself if you're looking to lose weight, instead of necessarily focusing on the weight of the scale. The circumference of the abdomen was probably even a better sign of your metabolic health. And that is it. So please like this video or hit the like button if you enjoyed it. Subscribe to the channel if you like information like this, as I plan on posting more. And thank you.